Innovation in healthcare is arguably one of the most important topics of our time. We all care about our healthcare, and without innovation, we stand still. This is a great time for innovation in healthcare. I'm Michael Krigsman. I'm an industry analyst and the host of CXOTalk. And today, on episode number 285, we are speaking with one of the world's top healthcare innovators. Before we begin, I want to say a thank you to Livestream. They support us and support CXOTalk. They provide our live streaming video infrastructure. And if you go to livestream.com/CXOTalk, they will even give you a discount on their plans. Now, I want you to please, right this moment, tell a friend. Tell a friend to watch, and be sure you subscribe on YouTube. This is important. Subscribe on YouTube. Without further ado, I'm so excited and honored to introduce Dr. Rasu Shrestha, who is the Chief Innovation Officer at the University of Pittsburgh Medical Center. Rasu, how are you? And thank you for being here.
Oh, well, thank you. Thank you for having me, Michael. I'm doing great. This is the Friday the 13th special episode, I guess. So it's a pleasure to be here, and thank you for having me as a guest.
Well, thank you. So please tell us about your work. You're the Chief Innovation Officer, and you're also responsible for the University of Pittsburgh Medical Center Enterprises. And so tell us about the things that you're doing.
Yeah, so I'm all but part of a larger team that really makes the magic happen at UPMC. UPMC is a large payer-provider organization. We're 80,000 employees, $20 billion in annual revenue. So we're a large organization. But my role, really, you can condense it down to I'm a bridge builder. Right. So what I do is build bridges. I work with the team that I have across UPMC to build bridges between, healthcare as we've known it in the past to healthcare as it needs to be. Bridges between the science and the medicine and the discipline of really pushing healthcare forward to entrepreneurship, to creating companies, to making commercial successes of innovations that we know have to be sticky. And bridges between computer systems, zeros and ones, AI algorithms, and human beings, patients, clinicians, just human beings that need to be utilizing these solutions at the back end. So in a nutshell, call me a bridge builder.
Okay, so you're a bridge builder among these various groups and technologies and data. But give us maybe drill down and tell us, so you're building these bridges, and what is the goal? What is the end goal of this bridge making that you've described?
One of the things that we look at with the lens of here at UPMC is, how do we continue to challenge the status quo and get healthcare from where it is to where it needs to be, right? We're a large dynamic system that continues to really push the envelope forward in terms of value-based care, and there's a lot of buzz around value-based healthcare models, and really moving away from fee-for-service to fee-for-value. What's interesting is, as a payer and a provider system, as an integrated delivery financial system, even we're not just talking about this; we're living and breathing it on a day in, day out basis. We're focused, and this is where the innovations naturally tend to focus themselves as well. We as a system are focused on pushing excellence forward in medicine and science, bringing technology to aid in that pursuit, but marrying that with a strong business acumen, a keen entrepreneurial zeal and enthusiasm to not just create innovations and adopt innovations that are cool, but to create innovations and think outside the box and implement these solutions that will be sticky, that'll make a difference, that'll move the needle in remarkable, transformational ways. So our goals really, Michael, are several folds, right? So our goals are to, move that needle forward, improve patient outcomes, improve patient satisfaction, all of the things that a lot of health systems obviously are very incentivized to do. But our goals also are to really innovate, create products, solutions, companies that we would implement these technologies here at UPMC that we call the Living Lab, and we would then commercialize with our partners. We would take out to market, and we would scale these solutions to impact healthcare at a much broader level.
So why this emphasis on building companies and business? What about healthcare, and what about your mandate leads to this?
So that's a really interesting question, Michael. And I dig back to why I even started this in the first place, right? I'm a physician by background. I'm a radiologist by training, and I went through med school, went through all of my training, and then did an informatics training as well. And as I pursued leveraging the power of data and informatics to better the care experience, to create solutions that would actually make a difference in the lives of physicians and patients, the bug really bit me, right? And one thing that I learned early on, and this was, I'd say, almost 20 years ago, is it's one thing to innovate, right? It's another thing to make those innovations sticky, to have a level of cultural change that's really required to scale these innovations and to make sure that they're able to get the level of impact that we know a lot of these great ideas and great innovations can actually bring to fruition. In order for you to do that, yes, you got to create the right product. You have to maybe have the right set of services. You have to have the right teams. There are lots of components to that. But you also have to, in many ways, make sure that you're building it in a way that it's sustainable over time, which oftentimes does translate to business success, commercial success. And that really is sort of the mantra that we have here at UPMC and at UPMC Enterprises, which is our innovation and entrepreneurship arm, is to make sure that we're able to really hone in on these unmet clinical and operational needs and create successes that we would implement here at UPMC, but where we would also take these successes and scale them at a level that others across the industry would also be able to enjoy some of the successes that we've been able to push forward at our institution. So
business building then is a core part of what you're doing.
Yes, absolutely. It is. I like to say that we put our money where our mouth is, right? So if we say, yeah, we're going to move from volume to value, value-based healthcare is important. Here's how we're pushing things forward, not just in the newer care models that we're creating at UPMC, the pathways that we're weaving into place and implementing across the care delivery institution that is our hospitals and our long-term care facilities, our senior care facilities, but also as a payer-provider system, looking at the business models, the revenue models, the financial models behind this. And with a level of entrepreneurial focus to this, to say, all right, but how do we make this sticky? How do we really scale this? And how do we perhaps synthesize some of these algorithmic imperatives into more of a business imperative, create companies and products and solutions that, again, we can really take out there.
Well, why is this so important, especially in healthcare? Because you're talking about business, yet it's also at the same time very clear to me that your ultimate goal is patient outcomes.
Absolutely. So what I'm looking at with the team at UPMC is really the perfect intersection between the imperative that we have to better patient outcomes, to better patient experience, to perhaps even redefine the very notion of what healthcare is really all about, and refocus healthcare from it being just about surviving to it really being about thriving, right? We are trying to redefine what healthcare is all about. But while doing that, in order for us to make it sticky, in order for us to scale it, in order for us to make sure that this is not just a once and done, we need to make sure that we're able to do this in a way that it actually can scale, right? So the business success side of this is really important. The other facet to this, Michael, really is also in terms of making sure that the innovations that we're creating aren't just UPMC centric, right? So as healthcare organizations, and there are many of my peers across the industry who know exactly what I'm talking about, because when you're part of a healthcare institution and you're creating solutions that, you're trying to fit into the intricate workflows, the complexities of your specific environment, you very often run into the slippery slope of codifying it to such a specific level that it only works in your institution. And the way that we've been approaching innovation is to say, all right, let's really look at this not just for our institution, but really with a mindset to make sure that it's able to interface with multiple different clinical information systems in a manner that where you could have multi-tenancy, you could scale it, you could really take it to the next level, and enjoy a level of outreach that you would otherwise not have been able to had you been sort of custom coding it to your specific environment.
I want to remind everybody that we are speaking with Dr. Rasu Shrestha. And right now, there is a tweet chat taking place, and you can ask questions and share your thoughts and comments using the hashtag CXOTalk. Rasu, what makes this particularly difficult or challenging in the healthcare environment as opposed to in other fields? Why is innovation in healthcare so particularly difficult?
Yeah, it's not just so particularly difficult, but it's also so particularly important, right? I believe there is nothing more personal, nothing more humane than really the pursuit of excellence in healthcare. And perhaps because it is so personal, it's not just work, it's not just something that you're tasked with doing. It's personal to you, to me, to everyone that's listening in on this today. It's about their lives, it's about their loved ones, it's about the people that they care for. And because it is so personal, I think we've made it so darn complex. And because we've made it so darn complex, it is so much more difficult to really innovate and take it to where it really needs to be, right? Complexity is the bane of our existence in healthcare. It really is. I mean, you look at the billing codes, you look at the complexity of the interfaces that we have at the back end, you look at the complexities of the workflows that we've managed to hash out over the last many decades. You look at the complexities of the interfaces that we've been rolling out in terms of these clinical information systems, even in the last 2 decades and more. Complexity is the bane of our existence in healthcare. But we also believe, and this is where UPMC Enterprises comes in, if complexity is the bane of our existence, then really design thinking is perhaps the cure. So we're trying to put on, a design thinking hat and the mindset of really innovating despite and in spite of those complexities, but really trying to take the approach of moving away from the complexities and simplifying healthcare. Right? Really trying to say, all right, look, it's not about adding bells and whistles. It's not about adding, tabs and buttons and features. It's about taking things away, making it as simple as possible, making it so darn simple that it just becomes so intuitive that you, at the end of the day, are able to then just focus at the tasks at hand. And that's what healthcare and healthcare innovation should really be about. So moving away from sort of the reality of complexity that we're inundated with today to where it needs to be, which is really focusing in on the most humanistic aspects of what it means to speak to a patient, to make sure that there is a level of communication that happens between the provider and the patient, that there is a level of understanding and empathy that speaks to what that patient and the consumer really wants, that healthcare then really becomes about not just taking a pill and hoping you get better, but when you're discharged from a hospital, that you're doing all of the right things so that you never hopefully ever have to go back to that hospital ever again, that becomes the new business imperative, that becomes the new reality of the future of healthcare.
And how does what you're doing, the innovation, lead to that? So if I may voice a skeptical perspective in healthcare, how is what you're describing even possible, and how does innovation lead us there?
So that's a great question. And therein lies sort of the approach that we're trying to put in place here at UPMC. We're very cognizant of the fact that everything that I just described to you, the painting that I just put in front of you, is a complex one, right? And it's dynamic. There are many things that are changing in real time right now. But at the same time, the approach that we've tried to craft here at UPMC and through UPMC Enterprises is one that we believe really puts us in a position of strength and gives us perhaps an unfair advantage to capitalize on who we are at UPMC and where we are in this day and time in our industry. So let me elaborate a little bit further. For us at UPMC, we really see innovation as a strategic imperative. It's not, just this thing that we're doing on the side and, let's play around with this for a while. And if it works, great. And if not, then we've got our core business to really focus in on. This is where we're putting in all of our chips as a system across the board and saying, look, we are really focusing on this as the future of UPMC. And the way that we've done this at UPMC Enterprises is we have I call it a servant leadership sort of a model where there's the provider organization, the health services group, there's the payer organization, our UPMC Health Plan, and then there's UPMC International. And then the fourth entity, that's UPMC Enterprises, works on behalf of and with the rest of the living lab, that's UPMC. So what we've done at UPMC Enterprises is really, and I think this is really the way to approach this, at least in an organization like ours, is we've created a safe space for us to ask those hard questions, a safe space for us to perhaps make those mistakes that need to be made, not just will be made, but need to be made in the pursuit of excellence in healthcare. And a safe space for us to have a level of undue focus on those pain points that I was referring to earlier, those clinical and operational pain points, and bring in, the discipline that's required around design thinking, around agile development methodologies, around a culture of fail fast, and an appetite to, as I mentioned earlier, put our money where our mouth is. And it's because of the tight levels of alignment that we have across our organization and the tentacles that we're building to further capitalize on the outreach efforts and the excellence that exists within the region here, and nationally as well, with sort of the entrepreneurial startup community and others within the healthcare industry that are as motivated as we are or share the same level of urgency and have the shared sense of vision and passion as we do, to together go at this journey and create these innovations that are sticky and scalable.
How extraordinary that a major medical center is not only paying lip service to this idea of innovation, but in a very meaningful and tangible way has staked its future on this commitment to because I speak with many executives senior execs from different organizations, and quite frankly, sometimes, they're doing innovation because it sounds nice, but really it's business as usual. We have some questions from Twitter, and let's begin with John Nosta, who's a guest who's been on this show, and I know you know John Nosta is somebody who we respect a great deal. And he asks, who is harder to change, the doctor or the patient?
That's a very John Nosta question. I love it. So at the end of the day, when I say we, both the physician as well as the patient, we're both human beings, and human beings, John, as you know, have this level of inertia. Where if things are working, let's do more of it. And from that perspective, I think it's difficult to change for both the physician in their own light. They've gone through years of training, and they're at a place where they have a specific set of mandates that we've put in front of them. So it's very difficult for them to change. At the same time, patients, right? Patients have a mindset that they've been, I guess, they've grown to expect, right? So I think the real answer to this is it's difficult to change for both of them. But let me turn this around and really get to where our head is, right? I believe, John, that where the industry is right now, and I'm not just talking about the last 20, 30 years that we've been rolling out health IT solutions, but really for centuries at a time, the healthcare industry, and this speaks specifically to the question you're asking in terms of change and the doctor and the patient, the healthcare industry has really been very paternalistic, right? It's been about paternalistic care. We need to move away from what we've known healthcare to be, which is one where we're pushing paternalistic care forward, to one where we really push participatory care forward. So from paternalistic care, it needs to move to more of a participatory care approach. And that really is the new reality. And when we approach healthcare with the lens of more of a participatory care, an intelligent participatory care approach, then what we do is we suddenly incentivize and make it easier for both the physician as well as for the patient / consumer to really not just want to change, but have to change. And therein lies the difference. I think today, because of the complexities that we just talked about earlier, because of the constraints that we've built around the systems that define healthcare today, around the technologies and the IT solutions that really shackle us to the realities of the workflows that we're constrained to today, we continue to march down this path of a very paternalistic approach to care. But if we're able to really turn it on its head and innovate and think about these newer care models, think about these newer business imperatives, think about the newer definitions of what healthcare should really be about, then this newer paradigm of an intelligent participatory care model actually makes a lot of sense. Long-winded answer, but I think John deserved it. Thanks, John.
Okay, great answer. So this notion of moving from a paternalistic approach to healthcare to a participatory approach, I want to get to some more questions, but that I have to say that begs an entire discussion again of how do you drive that kind of change in a meaningful way, given the profoundly deep fabric of paternalistic attitudes. Actually, let me ask you that. How do you do it? How do you even begin to accomplish that?
So that's a great question. And it's really where our head is at UPMC Enterprises in one of our focus areas, which is really looking at consumerization of healthcare and marrying that with the realities of what's happening in terms of clinical care and population health, right? So one of the things that we truly believe in, and you're seeing this really across the board in the industry today, is consumers, and they could be patients, are leaning in a way that they've never leaned in before. They're more engaged, they're more incentivized to take charge of the wallet that they're now suddenly tasked with in terms of their healthcare spend. They're going to see Dr. Google before they come in and see a Dr. Shrestha. They're really concerned about the specifics of not just their treatment options, but their outcomes and their quality of life. So there's a level of leaning in, participation, if you can call it that you haven't seen in the past. At the same time, what you have are capabilities from a technology perspective, and we're struggling with some of these components, but there are capabilities that would allow for consumers and patients and clinicians not just to participate passively, but really actively in the care processes, right? So how do we empower patients to better take charge of their data, not just give them data, right? Free the data, give patients access to the data. Yeah, that's really important, but it's not just about giving them access to the data. It's also empowering them, giving them the right set of tools and capabilities to make sure that they're able to participate in the intelligent shared decision-making that needs to happen around what's most important to them and to their loved ones. So you're seeing that shift happen. What we need to do is to really catalyze that shift with the innovations that we're creating, and then add to that the specific business models that would really make this sticky and make this the new reality of what healthcare needs to look like.
So changes across various key points, ranging from economics to culture through the entire ecosystem of healthcare, essentially, is what you're saying.
Correct.
So we have some more questions from Twitter. And Pablo Pinto is asking, is it possible to solve the lack of electronic medical record portability? How can technology and the industry empower and let users and patients have more control over their own data?
So that's a really, really good question. And so, my answer is yes, it is possible. The reality is we've been struggling with this for a while here in healthcare, and we're still at a point where, it's much easier for me when I travel to, stick in my bank card at any ATM and take out money in the local currency from my account here in Pittsburgh than it is for me to, get my health data moving in a way that would perhaps help save my life or the patient's life that's in front of me. So we still have a lot of struggles. We still have a lot of challenges at hand, but the reality is that's the imperative. That is what needs to be done, right? When we talk about the struggles of interoperability and where we've been in the last decade and a half in this journey of interoperability in healthcare, we've really been just focused in on the specifics of interoperability around the electronic medical record systems. And that's important, and there's much work yet that needs to be done, and we're seeing some remarkable advancements being made with the opening up of these capabilities at the back end, with the Argonaut project leading the charge around HL7 Fire and creating capabilities for us to have specific data points and access points to data elements that in ways that we just hadn't had access in the past. So there's some progress that's being made, but what we really need to do to make that actually a reality is for us to scale this, for us to open things up in a way that we just haven't been able to open up in the past, for us not just to pay lip service. And I'm not looking at any one vendor, I'm looking at the industry as a whole. When I address this challenge that we have, we shouldn't just pay lip service and say, yep, we've checked the box, we're doing FHIR or we're doing interoperability. It's not about that. It's about looking at not just a handful of specific say FHIR-based resources that need to be opened up, but the entirety of what is actually required to enable a smoother, say, care transaction to happen, to enable a specific set of workflows around, say, telestroke or around, transitions of care. And when we look at those specific set of requirements and we say, hey, look, it's not just, read-only type capabilities that we need opened up. It's also perhaps write-back capabilities. We need more of a bidirectional, more fluid sort of interfaces, a set of interfaces that need to be put in place. And when we try to specify what those needs and imperatives are, then we start making progress. We start going from this hand-waving vagueness that we seem to be stuck in today of, hey, we got to open up. Hey, let's do interoperability. Let's get interoperability right, to the specifics of here's exactly what we need. The customers are actually demanding this. Here are the specific set of clinical and business imperatives that are equated directly to these specific set of asks. That's when the industry starts coming together to really make that the data liberation challenge that we have in front of us a reality.
And we have a couple of questions from Twitter that are related to this. And Zachary Jeans and Arsalan Khan are asking, How do we spark new thinking among physicians? And at the same time, how do we get physicians to think about technology beyond just being a user, but actually harness that technology? And I'll even inject, what about data? Get physicians to be thinking about the role of data.
So I vehemently believe that data science needs to be a new specialty in medical school, right? I think it's in this day and age. We're talking about 2018. 2020 is like literally less than 2 years away. It is so important for us to have data science ingrained in the practice of how we're actually pushing healthcare forward. So physicians and nurses and other care providers really need to be bought into this, pharmacists and others included. How do you do this? That's the big challenge, right? Today, physicians, unfortunately, are an afterthought when it comes to health IT rollouts. And I say this because I've seen this happen in front of me, right? Where, with the right intent in mind, with the right intentions in mind, you have an RFP process. You go out and you say, all right, here's the best in class products around, say, a clinical information system, an EMR or a PAC system, and you do all of the due diligence to decide perhaps the finalist, and you go and sign the contract. And when you're about to go live with that solution, you say, hey, let's bring in our physicians. Let's have a go live event. Let's put in some training. Let's buy them pizza. Let's and create cheat sheets. And that's not the time to engage physicians. That is way too late in the cycle to engage end users. And the approach that we're taking at UPMC and at UPMC Enterprises really is where we engage end users first, right? Before we've even written a single line of code, we're sitting down with physicians, we're sitting down with patients, we're sitting down with nurses, and we're whiteboarding and we're brainstorming and we're talking about not what solution they want created, but what their pain points really are, right? The notion of design thinking mandates that you really start first with empathy. And you put yourself in their shoes and you sit down with them in their environment, not in a sterile, fancy room, somewhere else in Silicon Valley or but really in the hospitals, in the trenches where, they're seeing those pain points being experienced day in, day out. So you sit down with them, put yourself in their shoes and really empathize with them, but get them involved in the care processes, train them to really understand why it is that you're actually pushing for these data elements to be connected together, why it is and how it is that you're actually creating these solutions. But get their insights, get their buy-in. And there's no other better way to get the buy-in of physicians than to really engage them early on, but to have them be part of the process. Physicians in general are very bright people and they're very inquisitive and they want to do what's in the best interest of patients. There's no doubt about that, right? But they're constrained, they're handcuffed with the solutions that we've given to them, with the set of mandates that we've put in front of them. But if you open up those set of handcuffs and say, hey, look, you can be part of the solution, right? Let's create a blank canvas. Let's pull you in and really sit down and talk about the pain points that you currently have. And then we'll talk about the solutions, the technologies, the approaches that we need to put in place, engaging them right from the onset and keeping them engaged in the process of innovation. That's the way to really make sure that mind shift changes actually happen at the physician level.
Okay, I'm continuing to jump into Twitter because I love answering questions on Twitter. And I want to remind everybody we are speaking with Dr. Rasu Shrestha. And at this moment, there's a tweet chat taking place using the hashtag CXOTalk. And so please ask your questions. We have a really good comment from Jared Jeffrey, and I want to address this one because it's sort of fundamental to this. And he asks, what are the game changer innovations, the major game changing innovations in healthcare today? Is it AI? Is it blockchain? Is it other things that we may not be aware of? So where's the focus of innovation today?
So, Jared, great question. Thank you for that. The problem with healthcare today is, and not just healthcare, but really the reality of the age that we live in today is that there's just so much hype. There's a lot of hype around AI and smart dust and blockchain, and it's less about the technology. It's more about what the technology can really do to, in our case, better the pursuit of healthcare. Right. So is AI important? Absolutely, it's important. AI has been around, however, for a long time. The set of capabilities to make AI sticky and scalable, which is sort of the mantra that I've been harping on now for the last for the duration of this talk, is it's more real today than it's ever been before, right? So is AI an example of an innovation that would really, be important for us in healthcare? It absolutely is. Less because of the buzz surrounding AI or blockchain or smart dust or augmented reality or anything else, but more because of how we can actually use that technology to affect change, how we can use technology to really affect behavior, and how we can actually move the needle in the way that we're pushing care forward. So let me give you an example, right? So yes, AI tends to be a buzzword, and there's this notion of, hey, run for the hills, the machines are coming, right? But AI used well could really help in augmenting the care that we're providing to our patients. So around clinical decision support, for example, right? As a clinician, we're able to maybe synthesize, a couple of streams of data, 10, 12, 2, 15 streams of data at any given point in time, let's say, right? But computers, algorithms can synthesize and compute thousands, hundreds of thousands, perhaps millions of streams at a given point in time. And if we're able to use the power, the computational power of these AI algorithms to really look at vast troves of data, connect, these silos of databases in a way that they've just not been able to have been connected before, and give us the insights that we could then use to make decisions as physicians and as human beings, to connect with the patient that's sitting in front of me and to contextualize it to the specifics of what may or may not work precisely for that patient or that consumer that's sitting in front of me. Therein lies the perfect intersection of technology and use case, right? So is AI sort of the next big innovation? I'd say no, it's not. It's what you can build out of AI, the things that you can build atop of AI and blockchain and augmented reality. It's those things that really are the innovations that we should be focusing in on.
So applications using tools and techniques and approaches like AI or blockchain, for example, and then applying them, making them domain specific and useful in a practical and meaningful way.
That's exactly right, Michael. And put it another way, I'm a big believer of, look, innovation, if done right, makes technology invisible. So, our focus shouldn't really be the technology. Yes, as technologists, that's where we gravitate towards. And absolutely, we need to make sure that we have the right database, the architecture, the right set of technological bells and whistles, but the focus in terms of how we actually push these innovations forward and make them sticky should really be on those use cases, should really be on the specifics of how we actually do what we need to be doing, whether it's around medication adherence, or whether it's around clinical decision support, or in my case, reading a study as a radiologist.
Thank you for the shout out to enterprise architecture, because we had a comment from Arsalan Khan specifically on that point. We have another really interesting question, and an important one, from EK Obion. And EK asks, is there a standard framework for innovation that UPMC uses? How do you manage the financial implications of innovation, given the fact that innovation by, I'm interpreting this person's question, that innovation by definition involves an investment today with a potential future outcome, which may distract or divert resources away from the immediate needs and pressing needs today? How do you balance the long and the short term?
Yeah, so great question. And there are essentially two questions to this, and I'll try to be short in my answer. There is no one-size-fits-all approach to innovation, right? So is there a specific blueprint in which, in how we're innovating at UPMC? There absolutely is, right? Engage with us online. We're online all the time. Hashtag UPMC Innovates. Look at us on our website, upmcenterprises.com. Come visit us in Pittsburgh. We're happy to host you here. We're an open book in terms of how we're pushing the needle forward in terms of innovations. But there is no one-size-fits-all approach to innovation. Our approach to innovation may not work in your specific reality, in your organization, in your institution, in your hospital, in the facility that you belong to. But there are some best practices. There are some specific things that should be done, and there are many other things that perhaps shouldn't be done that we know have worked in our pursuit of innovation. So the second part of the question there was really around this challenge of it actually costs money to perhaps innovate, and you're so busy doing the things that you're doing that you don't perhaps have the time to devote resources to something that might have outcomes that will be seen only down the road. So my take on that, and this is our take at UPMC, really is, because you're busy, because of the ambitions that you have around growth and the aspirations that you have around improving care and really challenging the status quo, because of all of that, you cannot afford not to innovate. So you have to have buy-in, and that's one of the things that we've seen to be of tremendous benefit to us at UPMC. Buy-in from top down, right? So this starts really at the very top of your organization, at the board level, and it percolates downwards to the rest of the organization. A level of buy-in that this really is of strategic importance to your organization, that we're actually going to invest significantly, because we believe that this is how we're going to continue to differentiate ourselves from the rest of the competition that exists out there. So if you don't have that buy-in, and there are many other components to this, but if you don't have that level of buy-in, then it becomes all the more challenging. But what I'd say is, look, you don't have to boil the ocean day one. You start by showing early success and build on those early successes, but also focus in on creating a culture of innovation. And this is a topic that we could talk for a very long time. But it's important for us not just to innovate, quote unquote, innovate for the sake of innovation, but really for us to use this as an opportunity to create mind shift, to engage end users and show them the benefits of really embracing innovation in a way that would help them do the things that they feel most passionate about.
Okay, we're almost out of time, but you're involved in a couple of very interesting projects, and I think we really do need to talk about them at least briefly. Number one is you have been asked to lead the VA, the Veteran Administration's Open API Pledge. And so please tell us about that.
Yeah, really exciting, Michael. The VA is about to pull a trigger on what would perhaps be the most significant, and by significant I mean not just in terms of monetary value, upwards of several billion, but also significant in terms of the impact that it'll have on the veterans and their families, and quite honestly, the industry as a whole. So they're about to pull a trigger on an electronic health record modernization mandate that's in front of them. And what's happening right now is there are academic organization, healthcare organizations, so UPMC, we're all in on this, and we have the likes of Partners and Mayo and Rush and Intermountain and many others that have really come together as the original signatories around this Open API pledge. And my role really is to work with my colleagues across the industry to really pull them together, to get them excited around this imperative that we have in front of us, which is, as the VA contemplates the specifics of rolling out, a large commercial solution and making sure that we're able to continue to innovate for the sake of our veterans and their families, how do we use this as a nidus, an inflection point to not just better the quality of the applications, the workflows, and the solutions that we'll be implementing at the VA, but really use this as an opportunity to perhaps get interoperability right once and for all for the entirety of industry, for the entire industry. So the opportunity at hand is tremendous. And what I'm seeing is a level of leaning in, not just from the original dozen or so signatories, but now, more than 100 others that have really pledged. And if you go to the Open API pledge website on va.gov, you'll have an opportunity to get more information on this and to actually join us in this pursuit. You'll see that there's a level of leaning in, Michael, that I've just not seen in the industry before. You've got large organizations that are committing to this. You have vendors, small, medium, and large, entrepreneurs, systems integrators, organizations like HIMSS that are pledging and saying, we're behind this 100%. Let's do this. So really excited about this, and I'm looking forward to making this really sticky for the industry as a whole.
We're almost out of time, but maybe you can come back and we can do an entire show on this set of issues you were just talking about. Before we go, please tell us also about the Health Data Palooza. And if I'm looking at their website and I see other names of amazing CXOTalk guests like Michelle Dennedy, who is the Chief Privacy Officer at Cisco, and Milind Kamkolkar, who's extraordinary from Sanofi Pharmaceutical. And so please tell us about the 2018 Health Data Palooza.
So really excited about this. I'm privileged to be a co-chair of Health Data Palooza along with Kelsey Millard, who is my fellow co-chair as well. So the Health Data Palooza is going to be happening in just a couple of days, April 26th and 27th in DC, a perfect intersection of public and private and policy really coming together, talking about all of the things that we just talked about here on the show, the imperative to capitalize on health data, but really move the needle in healthcare. And it can't happen. That cannot just happen when you're in your own private bubble, right? Whether you're in your organization onto yourself, or you're in a different conference where you just have all of the vendors on the public side coming together or the private side coming together. It has to be where all of these entities are coming together and having open discussions about best practices, what's worked, what's not worked, but also how do we scale this? How do we take it to another level? So this year, especially excited about the level of leaning in that we're seeing from the patient population. So a lot of patient engagement, and this is a patients included conference, but also the who's who in terms of affecting change across the industry. So from the private sector, you've got key speakers coming in from Twitter and from Amazon and many other organizations that are really affecting change. You've got other speakers and remarkable leaders coming in from payer and provider organization, from the startup community, but also from the government, from the FDA, from CMS, from the Health and Human Services. All of these remarkable leaders really coming together and talking about how we collectively lift the boat together. So really excited about Health Data Palooza. Hashtag HDPalooza for those of you online. Follow along, but I hope to see all of you in Washington, D.C. for this really important conference.
Okay. Wow, what a very, very fast 45, 50 minutes. This has been Dr. Rasu Shrestha from the University of Pittsburgh Medical Center. I can't thank you enough for taking your time to be here with us today.
Thank you, Michael. A pleasure.
Everybody, you have been watching episode number 285 of CXOTalk. Now is the time. Tell your friend to watch. The replay is up. And be sure to subscribe on YouTube. Thanks, everybody. Go to CXOTalk.com. We have many more shows coming up. And thank you to Dr. Rasu Shrestha. Have a great day, everybody. Bye-bye.